Every week, community health workers in Costa Rica set off to make home visits with families all across the country, from remote mountainsides to the suburbs of San Jose. Home base for community health worker Hilbert Zunigo is the Chinaquicha Ibais, one of Costa Rica's more than 1,000 community-based primary healthcare centers providing care to all of the country's nearly 5 million citizens. Run by Costa Rica's Caja Costarricense de Seguro Social, the Ibais meets most of the health needs for families, from prenatal care, preventive screenings, and chronic disease management to wellness programs. When referrals are needed, the Ibais teams coordinate care with specialists. Community health workers, known as ATAPs, also make an annual visit to each family in their homes to strengthen ties to the community and proactively assess their healthcare needs. More vulnerable patients who cannot easily travel get regular checkups. The ATAPs crisscross the sometimes rugged tropical terrain on motorcycles, ATVs, and trucks to get their patients. Today, Hilbert is visiting the Obando family on a mountainside in an indigenous region of Costa Rica. Here, he will do a health check-in with Tamara and her son Jaime, checking vital signs and medications and keeping little Jaime on track with his vaccines. And he will take extra time with Tamara's brother, Ever, who has cerebral palsy and is unable to travel regularly to the local Ibais clinic. Hilbert logs everything in the family's electronic medical record using a mobile device and makes note of his visit on the ATAP visit log in the home. The electronic records can easily be reviewed by the rest of the Ibais team back in the clinic. This remarkable investment in community-based primary health care is one of the ways Costa Rica has created one of the best health systems in the world, with nearly universal health coverage, lower costs, and better health outcomes. The Costa Rican model excels in providing its citizens with the core functions of primary health care first outlined by Johns Hopkins physician Barbara Starfield. Primary health care should deliver what are now known as the 5 C's: a first point of contact, continuous, comprehensive, coordinated, and person-centered care. Costa Rica achieved the 5 C's with the help of a process called empanelment, geographically organizing the population into 106 health areas, each with about 10 Ibais clinics. Each patient is assigned or empaneled to a multidisciplinary Ibais team made up of a doctor, nurse assistant, a data specialist, and a community health worker. When a person gets sick or has a health need, their first stop is the Ibais in their community. Providing patients with a trusted gateway to the health system takes the guesswork out of healthcare for families and allows many issues to be resolved at the primary care level. Continuity is a key feature of the Ibais clinics. Patients see the same provider for many years, giving them a trusted partner in their health. Patients have a coherent, connected, and consistent experience of healthcare that responds to their medical needs and social context throughout their life. This continuity enables the health system to manage non-communicable disease through early detection, counseling, and effective treatment. Primary healthcare in Costa Rica is comprehensive. Ibais teams provide all but the most specialized care to their patients. In 2018, Ibais teams provided 3/4 of all medical consultations in Costa Rica and cared for the vast majority of health needs: health education, medications for acute infections, disease prevention and screening, management of chronic disease, and wellness programs. An important function of primary care is effective care coordination. Ibais clinicians have frequent and detailed communication with each other about patient needs and patient care plans. This coordination eases patient transitions between primary care and specialty care and ensures that patients are not lost in the healthcare system. Ibais teams provide care that is person-centered. Having Ibais teams situated in their communities allows Costa Ricans to be seen as more than their illness. Their care takes into account their social, career, cultural, and family priorities as an important facet of health. Costa Rica's primary healthcare system is strengthened with the collection of health and quality data by Ibais team members that is shared with local health area directors who aggregate the data for national and local use. The data are used to improve quality of care and monitor health trends. This robust primary healthcare delivery model has produced health outcomes that rank among the region's best. Life expectancy is one of the highest in the Western Hemisphere and has increased every year of the past 5. Access to family planning services and prenatal care is nearly universal. Babies and children are healthier, with some of the lowest neonatal and child mortality rates in the Western Hemisphere. And the average person has only $26 a year in out-of-pocket health expenses. With a primary healthcare system that is accessible, continuous, comprehensive, coordinated, and person-centered, Costa Rica offers a model for countries everywhere as we work toward universal health coverage for all.